Welcome back. It's February 26th, 2026. Today, we're diving into a healthcare landscape that is moving faster than ever. From massive infrastructure launches in Kolkata to new data showing how AI is literally saving minutes in emergency handovers, hospital management is no longer just about running a facility. It's about managing data and people in real time. If you're a healthcare leader, an HR professional, or an investor, today's headlines are a roadmap for the rest of the year. Let's get into it. Segment 1. Infrastructure and Market Expansion. The 250-bed Heritage launch. Charnock Hospital has officially launched a new 250-bed Heritage facility in Kolkata, signaling a trend where modern clinical care meets boutique, patient-centric environments. Waste management boom. New market data released today by SNS Insider shows the global healthcare waste management market is set to hit $89 billion by 2035. For administrators, this means tighter environmental regulations and a necessary shift toward circular economy technologies starting now. Regulatory watch. The National Medical Commission, NMC, has proposed new amendments for establishing medical institutions. If you're planning an expansion or a new medical college, these rating regulations are your new Bible. Segment 2. Operational Breakthroughs. The 7-minute gain. Emergency efficiency. Huge news from A&E departments today. Ambulance handovers have been slashed by over 7 minutes on average compared to last year. The management lesson. Despite 5-year highs in patient numbers, staff are using real-time data and event-driven architectures to clear beds faster. The real-time hospital. We are seeing a massive shift from legacy EHRs to continuous awareness systems. AI-driven triage is no longer a pilot program. It's the backbone of the 2026 hospital, helping nurses prioritize patients before they even walk through the doors. Segment 3. HR and Workforce. The 2026 Outlook. The Retention Crisis. Cross-Country Healthcare just released its 2026 Healthcare Workforce Outlook. The headline? 70% of healthcare leaders cite burnout and retention as their number one threat. The solution? Leaders are moving away from one-off fixes. The focus is now on AI-enabled forecasting to predict staffing needs before they become a crisis. The pay gap. In the UK, new data shows care workers are earning just 39p above the national living wage. For HR managers, this means recruitment is about to get much harder as we head into the April statutory minimum wage hike. Trauma management for staff. A fascinating study in Lancet Psychiatry today highlights a simple but effective tool for staff burnout: digital imagery tasks, like Tetris, to help relieve trauma symptoms in frontline workers. It's a low-cost, high-impact wellness strategy for your HR toolkit. Segment 4. Strategic Finance and AI Governance. Financial pressures. Healthcare Global, HCG, is closing its trading window today as it navigates a massive rights issue to stabilize high debt levels. It's a reminder that even in a growth market, financial structure is everything. Taming the AI Wild West. A new report from Premier Incorporated warns that while 71% of hospitals have AI, 80% lack internal governance standards. HR Directive. Your task for 2026 is no longer buying AI, but governing it, training staff to work alongside digital employees who manage contracts and logistics. The shift in hospital management. India. Start with the digital-first shift. Indian hospitals are moving away from manual record-keeping to becoming tech hubs. Today's big news. Mention the National Arogya Fair 2026 in Shigan, where President Murmu emphasized making traditional medicine a people's movement. Operational context. Hospital administrators today aren't just managing beds, they are managing data ecosystems and AI integrations. Technology and AI, the SAHI and BODH revolution. New initiatives. Discuss the launch of SAHI, Strategy for AI and Healthcare for India, and BODH, Benchmarking Open Data Platform for Health AI. Impact on operations. Voice-to-text prescriptions. AI models now convert a doctor's voice directly into digital records, integrating seamlessly into hospital management information systems, HMS. Early warning systems. New AI-powered surveillance systems are being deployed to detect disease outbreaks early. Hospital Spotlight. Indo-German collaboration on mobile health and telemedicine discussed at the recent IGSTC Strategic Conclave. Infrastructure and Policy. Budget 2026 implementation. The funding boost. Following the Union Budget 2026 to 27, a record 1.06 Indian rupees lakh crore has been allocated to healthcare, a 10% jump. Biopharma Shakti, a massive 10,000 Indian rupees crore initiative to move India from pharmacy of the world to a global biopharma hub, focusing on high-tech biologics and gene therapies. Operational expansion. Plan for 1,000 plus accredited clinical trial sites across India. Investment in district-level trauma centers and regional medical hubs to decentralize care from metros. Local highlight. Chhattisgarh has allocated 3,500 Indian rupees crore to strengthen its state healthcare infrastructure. Private sector trends and public-private partnerships, PPP. Hospital chain growth. Clove Dental recently launched 48 clinics in a single day, reaching 715 clinics nationwide, showing the scale of specialized chains. Manipal Hospital Yeshwanthpur marked Childhood Cancer Day with new patient-centric initiatives. PPP models. Look at Mumbai's BMC, which allocated 7,456 Indian rupees crore for health, emphasizing free medicine and expanded dialysis services via PPP centers. Training and education. Draeger India partnered with Breach Candy Hospital to launch a medical academy in Mumbai using VR-based simulation for training. Healthcare startups and niche specializations. Funding news. OnCare raised 27 crore Indian rupees to expand its oncology care network across India. Pulse, a Bengaluru startup, secured $4 million to build an asset-light medical equipment manufacturing brand. Specialized care, rise of the Gut Clinic, which raised $1 million to focus specifically on gastroenterology and metabolic care. Diagnostic breakthroughs. Sigtuple launched the AS76, an AI-driven morphology analyzer for labs, and OncoStem's AI test for breast cancer is reducing unnecessary chemotherapy. Summary. Hospital operations in 2026 are defined by decentralization, moving to Tier 2 and 3 cities, AI integration, SAHI/BODH, and biopharma research. Call to action. Do you think AI-driven voice prescriptions will solve the long waiting times in Indian OPDs? Let me know in the comments. That's the wrap for February 26th. The takeaway is clear. The most successful hospitals this year won't just be the ones with the most beds, but the ones with the best data and the most supported staff. If you found this helpful, hit subscribe for your daily healthcare management pulse. I'll see you tomorrow. Disclaimer: use the content after verification.